COVID has seen mental health services busier than ever. But for many young people, accessing supports predated the pandemic. For Grace, it was when she was just 14 years old.
I've been having trouble with my mental health for a couple of years and it'd been declining pretty quickly, but when I was diagnosed with my health condition, it got a lot worse. I was really struggling with home life, school, my self-esteem, everything. And yeah, it got to the point where I didn't want to be alive anymore.
Fortunately, Grace's GP intervened before it was too late. She was put in touch with Headspace, where she was assessed and given the support she needed.
To be blunt, it saved my life. I got linked in with a psychiatrist, I got on medication, I got the space to work on personal issues.
And while this worked for Grace, a new study has found there have been many others who've fallen through the cracks of the system. The progress of more than 1,500 12 to 25-year-olds was monitored over 2 years by researchers from the universities of Sydney and Sunshine Coast. Over that time, 2 in 3 young people with emerging mental disorders didn't experience meaningful social or occupational improvement. The worst results were seen in those young people who had complex issues, from having been hospitalised prior to having comorbidities. It is those complex needs that Headspace says it wasn't designed to deal with.
Just like a medical ward in a hospital isn't equipped or designed to be an intensive care unit, our focus at Headspace is on early intervention with young people experiencing high risk factors and high prevalence disorders, just like anxiety and depression.
That's not to say the system isn't under pressure.
There is a great deal of strain across the mental health system when it comes to having an available workforce to meet the needs of all people at all ages and at all stages of their continuum of their mental ill health.
Finding the right clinician, Grace says, was key to her recovery.
You're not going to make any progress if you don't connect with your clinician. So it's really important to find someone who accepts you for who you are.
And while Headspace is looking to boost its workforce in order to keep supplying adequate care, it, like many other advocates in the space, wants the government to create a new level of care which focuses specifically on supporting young people with complex issues.
Headspace has been set up to be there for young people, heavily designed by young people. So it's a success on its own. Now it is time to build the next pillar of the mental health system.
Ian, how has this happened? How has it happened that a system's designed where we get people in the door and there's nowhere for them to go?
Things don't move quickly in this country, Julia. I was part of the movement in Pat McGorry in 2004. Anyone remember the 2004 election?
Oh, yeah.
Mark Latham.
Unforgettable.
To actually say young people were in trouble. John Howard, to his great credit,
yes,
committed to the business. Headspace, it came into being in 2007. I was part of research in the 1990s. I'm that old. So young people couldn't get in through general practice, to create a front door, to create an entry. As Jason Strathowen said, so anyone could come in, not just those with the most severe problems, but across the range of difficulties, and everyone has. So Headspace is a great success in bringing people in. However, 2/3 of people at the time they come in already have complex problems. The thing at the time then, between the deals that were done by John Howard and deals between John Howard and Morris Yema, is in a Harbour Bridge-like way, one would start building the acute services at one end from the States, and the others would start building the primary care services. Never agreed to meet in the middle. Never agreed to actually complete the job. And we've been in a stalemate since about 2007 onwards as to what will happen next. And so we've opened more and more. Every time we have a federal election, I'm sure we'll have more next year, you'll have more Headspaces. What we're seeing in Victoria is Dan Andrews doing a great job of committing to the acute services, the hospital services, for the very severe end. He's going to put in $3.8 billion over the next 4 years just for Victoria and just for the acute services. That's a really big start at one end. But the bit in the middle has never been built. And it's really what's changed here is the realisation that mental health problems start when you're young, and if you don't intervene when you're young, then the economists care, because you don't go to work, you don't finish your education, you don't establish families. And the lifelong costs of that are huge. Issues Craig and I are tied up with about the mental health, but mental wealth of this nation. You've got to make the investment, you've got to build it. But we have been stuck since 2007 in, well, who's going to take responsibility? The Prime Minister and others committed, but the Prime Minister in particular, to have a new national plan released by November this year. Remember COVID happened?
Yes.
And the mental health pandemic has been hardest on young people and others. So there's been a 45% increase in emergency room presentations in New South Wales alone over this period. Have we got on with it? No. November's passed. The new deal that was supposed to be announced hasn't been announced. We'll all be off to the beach and the races and the racetracks and wherever else we go. Not announced. Then we'll go on an election campaign, and guess what? they were saying, I've talked to several senior politicians this week, well, mental health's not a really big issue for the, for the election. We're going to go back and it'll be about the economy and about jobs. And you go, actually, you know what? In every regional electorate I've gone into, and every independent electorate person I've spoken to, one of those independents who are running, it's a huge issue in the community. John Howard did a really smart thing. He had focus groups back in the 2000s, and the two bits of the Australian healthcare system that people worry about are mental health and aged care. And guess which are the two that haven't coped during COVID? Mental health and aged care. But a huge amount goes into the other bits, as it needs to. So it's a huge issue on the ground, but the disconnect between that and real action. And we're about to have a new national plan, which after 30 years is going to agree to what Paul Keating agreed to in 1993, better federal-state relationships. So they'll each keep building their own bit, and the bit in the middle still won't get built.
We still
won't build it.
We still don't know.
So we're just, the healthcare and health reform is hard.
Right.
It's really hard. You talk to young people, sure, tomorrow, I go to North Queensland, I go to North and South Coast of New South Wales, I was talking to people today in rural Victoria, you know, everywhere, in Tasmania, northern Tasmania, you know, we know what to do, but the political impetus to do it,
it's just...
no, it's just not there.